Australia, researchers are calling vaping a young person phenomenon. Statistics from the Melbourne University Hilda survey show 14.1% of Australians over the age of 15 have used a vape or e-cigarette. These products have been on the rise for the last few years, with the Australian government now implementing regulations, which is changing the way people access vapes. From the 1st of July this year, nicotine vapes have been classified as therapeutic goods, meaning they can only be accessed from a pharmacy with a doctor's prescription. However, from the 1st of October, these government-issued vapes will be accessible to anyone over 18 without a doctor's prescription. So far, the outcome of these new laws has seen businesses such as tobacconists and convenience stores remove the advertising of vapes from their shopfront, as it is now illegal for any retailer to sell vape products. But what does this mean for young people, who some researchers say are the most susceptible to vaping? Well, we took to the streets of Melbourne to find out.
Yeah, you just have this whole younger generation addicted to them now. There's no sort of harm reduction for them.
When everyone's doing around you, just do it. Yeah, want to be a part of something, I guess.
Peer pressure.
Peer pressure's a big one.
There's a million different places in this city I could go and get a vape, like whether the government knows or not, you know what I mean? And I feel like it doesn't really stop the school kids either.
Associate Professor Michelle John-Janellis from the University of Melbourne has done extensive research on e-cigarette use among young people, and she says these legislations are just the start, and success will depend on enforcement.
We have the federal government, but then we have all the states, and the states actually have a lot more control of things than the federal government does. So we end up in this sort of weird situation where the federal government has this legislation, but it's then up to the individual states potentially to enforce that. Is it the police that are meant to be going in and shutting these retailers down? Is it the public health units, local public health units that need to do this? I think we need to really now go, we've made the policy changes, let's see how they go for the next few years, but let's make sure we're enforcing these changes.
19-year-old law and economics student Lola Cable believes a lot more needs to be done than just banning the selling of vapes.
If you make the regulations too strong, I think then you open up less safety, and then people start buying vapes that they really don't know what's in them, which is like super unsafe for like young children. And also, if you put a tax on it, then it makes it really expensive for low-income earners, which I think is an inherent disadvantage because a lot of low-income earners are the primary users of nicotine products.
Many of the young people we spoke to started vaping as teenagers, quoting social norms as a significant influence in their decision to start vaping. Dr. John Janellis says there is also a clear correlation between mental health and vape use among young people, which some vape companies use as a strategy in advertising.
Of course, adolescents and young adults are going to turn to these products maybe to help with their psychological distress if they're seeing this advertising for these products that say they're calming and they're going to restore you.
The government has started anti-vaping campaigns targeting youth, using the catchphrase, "Why are we still doing this?" These campaigns have been made public on free-to-air television, but Dr. John Janellis says they would have had more impact on social media where more young people would see them. Ms. Cable says young people will access vapes anyway, and the campaign would be more effective if it focused on education and transparency, giving young people the autonomy to make their own decisions.
Vapes can have, I think it's like something like 5 times the amount of nicotine that cigarettes have. They have chemicals that aren't regulated, so we don't actually know what you're putting into your lungs a lot of the time. So giving greater education to young people and empowering to be able to make choices.
This has been Ashlyn Hannah reporting from Melbourne, Australia for See Today.